Vice Mayor Luca Bergamo from Rome, our capital city of the world, of civilization, and going through a very difficult peak now. How are things in Rome? Mayor, the floor is yours.
Thank you very much. Rome itself, the region, is not as dramatic as the north of the country, but the country also is in lockdown. So I will just concentrate on a few things, despite the presentation has more items, because many of the views have been already shared and things are in common. Few elements which I'd like to underline. First, there's a bunch of literature that's about the impact of virus and epidemic on a globalized society that spans even 30 years back that we did not consider. And yes, we are all caught by surprise. At the same time, there have been many Cassandras, narrating the reality we are actually living. We didn't look at because that was conflicting with a developmental model that was based on private consumption and globalization. I think we should learn out of that, because it's likely to be the first of this crisis, but not necessarily the last one. Which, to my end, implies that we have to seriously consider the full implication of a model, a developmental model that has been reducing the role of the public sphere in favor of the private ones. If I can see, by my point of view, an opportunity in this dramatic situation is that the majority of people is asking, all over the world, a presence of the public sphere to protect themselves. And that's where, cities are at the forefront, maybe not on, let's say, on the health side, because health side is mostly, at least in Italy, competence in the regions and the national states, notwithstanding there is a clear issue of the span of the welfare and how, by cutting public spending, we have been reducing the capacity of the system to respond. So there is a clear unpreparedness of public health system to deal with something that was anticipated, which is resulting of a view of the society that this epidemic challenged even more than the crisis of 2008. And I would expect that the impact of the crisis at the level, even when it's over, and it will take time before it's over, it will have an impact that in every people's life, and mostly on those that have less means, that really challenge the society we are used to. So there's an issue of rethinking things. The second point to me is we have been through in the country two progressive measures of lockdown. I mean, if you go back to the history, you may notice that we had first lockdown a few cities, then regions, then the whole country, then all activities and so on. Why that? You might have say, okay, why you didn't lock down everything as in China happened on Wuhan. The reality is that when China locked down Wuhan, it was 4% of the national population. We are locking down 100% of the national population. So one of the challenges in deciding what to do, what's the spread and length of things you do, is related to the width of the measure you are taking in relation to the nation as a whole. So to some extent, one of the point we have been concentrating in Rome was to act as much as possible, and I would say always in accordance with the national government. It was critical in Italy to avoid, given the fragmentation of competence, to avoid different local authorities and regions to run their own ways, while it was since the beginning clear that it was very easy spread all over the country. So how to get the balance between the different level of the competencies and powers in different situations is as well a challenge. It's not that easy. With regard to specific challenges, something that we all experience is the medical supplies. We have not. I mean, I found out that Italy does not produce masks or ventilators. That's not in Italy. You don't produce that. And then you have to buy it from here and there, and naturally there have been shortages and so on. Something that is popping up now is that we have been, everybody, assuming that the people, kind of home quarantine was easy mechanism to contain the spread of the disease. There are thoughts and debate leading to the hypothesis that probably would be better to have special locations. So basically using hotels left not used in order to allow people found positive to the virus to be quarantined, also the asymptomatic. Because what happened as well in the home premises that there is an easily spread within the narrow community, especially when there are elderly people in the family in the same physical space. In Italy, I don't know if that is a word case, but in Italy, men are much more hit than women by large. I was looking different data in different countries. Italy says substantial differences. Social distancing has implications. They are not only on social, there are naturally practical implications and massively economic implications. How do you deal with that is a massive problem, and a problem of global scale, not even a city scale. We have very limited means in order to compensate lack of revenues for the people, salaries and so on. National government has been taking kind of bold measure to do that, but we actually need to think long term if we have to deal with crisis of this end. Mechanism of minimum salaries that can be activated in front of this kind of crisis, because when you have to lock down people, then you have to give them the means to purchase food, simply to pay home rentals and so on. This is becoming crucial in certain sector. First, immediate has been culture, because culture and tourism have been totally suspended since the first lockdown in the country, and these are most people are working on basically on daily fees. So
one more minute, Luca.
Yes, I'm over. The other things which was pointed out is social services. You know that we as Spain is a country that's very elderly people. Part of the mortality ratio in Italy is certainly related to this characteristic. But we have systems where we put elder people in urbanized areas that don't have family assistance all in the same places. And these places are becoming really, really risky. And your experiences things in Spain very tough to be seen at this moment. So a very early measure is to take care of that kind of things, and the informal settlements. That's another one that has not been taken in charge yet, and I think it's a delayed bomb. And then a lot of things. For what I hope, wish, I think as we have to work on is rebalancing the relationship between the private sphere, the sphere of private consumption, and the sphere that we acknowledge as a welfare globally. And it is a priority, and it's a priority within cities that are substantially the deliverer of these kind of things. In the meantime, one of the challenges we have, and which was noticed by the Barcelona city as well, is to be able to fulfill collaboration with all those that provide services to the city and so on, because by reducing the services, we should reduce the contract payment, and that would imply job lost. So there are technicalities in the management of this crisis that impact on everything. We will be all very glad to share the one we have dealt with and where we are dealing, because that's they are massive and various. Thank you very much, really. Thank you very much for setting up this exchange that I think is really valuable.
Thank you very much, Vice Mayor. Thank you, Luca, for these insights. I think you have given us also a lot of food for thought in terms of how we would need to organize our next exchange, and this balance between the public and the private sector. How do we work it out in the aftermath of this? But also some issues around the confinement, which could be very interesting for the cases in Latin America and in Africa, because we are learning indeed. First of all, we need to know that not everybody has a home. Those homes we share with others, and some of the people that we share it with are the weakest and the most vulnerable. And so this new use of public spaces for the specifically affected is something that we need to think about. And of course, the big issue of procurement and production, which is